Today, Lucy, is about our pharmacists and what they have done during the course of the pandemic. 6.5 million vaccinations, 25 million rapid antigen tests through the concessional program. We've put in place things such as electronic prescribing with 98% of pharmacies participating. We have seen our pharmacists stay at their posts during the most difficult times, and I just want to thank them and honour them and acknowledge them. And we have a series of measures today that I want to outline in the speech. But with Professor Kelly, there are some significant next stages as we normalise in Australia, as we move through the process of returning to normal after 2 years of COVID measures. In particular, I've now received advice from the Australian Technical Advisory Group on Immunisation, and they've worked very closely with Professor Kelly, and they have recommended that there should be a winter dose or second booster, or in some cases that will be known as the fourth dose, for particular groups of people. These are adults 65 years and over, Indigenous Australians 50 years and over, aged care and disability residents, people aged 16 years and older who are severely immunocompromised. So those four groups, just to run through them again: 65 years and older, Indigenous Australians 50 years and older, aged and disability residents, and immunocompromised Australians over the age of 16. That dosing regime will start in our pharmacies, Lucy, in our general practices, in our state and Commonwealth clinics and our Indigenous medical clinics from the 4th of April, from Monday the 4th of April, and it's for a window for 4 to 6 months after you have had your first booster. And that's based on medical advice. We gave complete freedom to ATAGI, and Paul and his team have worked very closely with the medical experts, and I thank them for their work. They've probably considered this more closely than almost any other decision in reaching those outcomes. The next thing in particular is related to that. On the same day, on the 4th of April, we will also begin our winter flu program, and that is through the National Immunisation Program. Similar groups actually: adults 65 years and over, children under 5, pregnant women, Indigenous Australians of all ages, and people with particular immunocompromised medical conditions as well. They're part of the National Immunisation Program, where the government provides that for free, and in addition there is a very significant private market. We're investing $100 million in those measures. So those are the two very significant announcements in relation to the vaccination program, but at the same time, we've been reviewing the emergency state, the biosecurity determination. At this stage, we are down to 24 people on ventilation for COVID in Australia. That's down from 206 who were on ventilation in October. And cases will rise and they will fall, and at times we will see an increase in the number of people who are either in ICU. As Paul and I were discussing last night, in some cases they come into ICU with COVID, but certainly not because, and our ventilation is a key indicator. Those numbers will rise and fall, but the fact that the system is strong, the system is robust, every state and territory is prepared, and I want to thank and honour and acknowledge them for that work. And at the same time, the booster work that Lucy and others have done, the readiness of Paxlovid, Molnupiravir, Sotrovimab, of our different treatments, is helping to protect people. And so the country is ready to move on from the emergency declaration made 2 years and 1 month ago, what will be the case by April the 17th. So I will not be renewing the Biosecurity Emergency Determination. That's on strong advice from Professor Kelly and from our other medical advisors, the unanimous advice that was given to me, discussed with the National Security Committee of Cabinet, and the Prime Minister has also foreshadowed this with the National Cabinet, with the Premiers and with the states and territories. So there are a number of consequences of that. Firstly, as Health Minister, I will lose the plenary powers which are quite extraordinary, and I'm very happy to do that. That's about normalising Australia. But at the same time, as of April the 17th, 2 years and 1 month to the day after those laws will have been put in place, there will be no emergency powers, there will be no pre-flight testing, we will no longer need the price gouging rules in relation to rapid antigen tests. There are over 500 million of those tests in the country now, and we will end the prohibition on cruise lines operating out of Australia. That was foreshadowed last week. Non-emergency provisions, which will continue through non-emergency measures, will be the requirement to show proof of double vaccination for entry or exit into the country. Again, very strong medical advice to that effect, and also the continuation of masks on domestic and international flights. Again, strong medical advice to that effect. We've also spoken with the airlines and with the cruise lines, so they are informed. So that gives you a sense of Australia progressively returning to normal. But the best protection remains vaccination. And so if you are amongst that approximately 5 million Australians who will qualify for a winter dose on the basis of the medical advice, please come forward. And if you're in the 1/3 of Australians who've yet to have your booster, please come forward. It can protect you. The last thing I want to do is to announce a PBS listing today. We are at a Pharmacy Guild conference, Lucy, and the PBS underpins the way the pharmacy and medicines operate in Australia, and I'm delighted to announce that OFEV will be made available for, in particular, progressive fibrosis of the lungs. And this can be a catastrophic, agonising condition, debilitating condition, and ultimately a fatal condition. And so over 1,400 patients will receive access to this medicine, OFEV, for fibrosis of the lungs. And that will be from the 1st of May, and it would otherwise cost $40,000, and it would be as little as $6.80 under the pharmaceutical benefits scheme. And this is what we're focused on, saving lives and protecting lives, and to be able to, on the one hand, make sure that the next round of vaccination, the winter dose for COVID, the flu program, both beginning on the 4th of April, the normalisation and the withdrawal of our emergency laws, but then the listing of new medicines, that's what we should be doing. And I think, Ange, it's a very positive day for the country.